Mental health. Introduction. Definition and importance of mental health. Mental health encompasses our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also determines how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. A sound mental state is crucial for leading a fulfilling life, maintaining healthy relationships, achieving professional success, and realizing personal goals. Overview of the mental health landscape. In recent years, there has been a significant increase in awareness regarding mental health issues. Various campaigns, driven by celebrities, governments, and non-profit organizations, have brought mental health into the public discourse. Despite this progress, mental health disorders remain a leading cause of disability worldwide. The World Health Organization, WHO, reports that approximately 1 in 4 people globally will be affected by mental or neurological disorders at some point in their lives. Moreover, mental health issues can have profound effects not only on individuals but also on families, communities, and economies. In this comprehensive piece, we will delve into the historical perspectives, various types of mental health disorders, their causes, symptoms, and treatments. We will explore the impact of mental health on different populations and discuss the pervasive issue of stigma. Additionally, we will examine how mental health intersects with societal issues, the global perspective on mental health, and the promising future directions in this vital field. Historical perspective. Evolution of mental health understanding. The understanding of mental health has evolved significantly over centuries. In ancient times, mental illness was often seen through a supernatural lens, with afflictions attributed to demonic possession or punishment from the gods. Treatments were often rudimentary and harsh, involving exorcisms, trepanation, drilling holes in the skull, or isolation. During the Middle Ages, the approach to mental health continued to be dominated by superstition and religious interpretations. However, there were also early attempts at humane treatment, such as the establishment of asylums, though conditions were often poor. The Enlightenment era marked a shift towards more scientific and compassionate approaches to mental health. Figures like Philippe Pinel in France advocated for the moral treatment of patients, emphasizing the importance of kindness in structured environments. This period also saw the beginnings of psychiatry as a medical discipline. Key figures and milestones in mental health. Philippe Pinel, often referred to as the father of modern psychiatry, Pinel is known for unchaining the mentally ill in Paris and promoting humane treatment. Dorothea Dix, an American activist who campaigned for better conditions for the mentally ill, leading to the establishment of many mental hospitals. Sigmund Freud, founder of psychoanalysis, Freud's theories on the unconscious mind and early experiences influenced the understanding of mental health. Émile Kraepelin, known for his work in classifying mental disorders, Kraepelin's contributions laid the groundwork for modern psychiatric diagnosis. Carl Rogers and Abraham Maslow, pioneers of humanistic psychology, emphasizing the importance of self-actualization and personal growth in mental health. Aaron Beck developed cognitive behavioral therapy, CBT, a widely used and effective treatment for many mental health disorders. Types of mental health disorders. Anxiety disorders. Anxiety disorders are characterized by excessive fear or worry that affects an individual's daily functioning. Common types include generalized anxiety disorder, GAD, persistent and excessive worry about various aspects of life. Panic disorder, recurrent panic attacks, which are sudden periods of intense fear. Social anxiety disorder, intense fear of social situations and being judged by others. Specific phobias, irrational fears of specific objects or situations. Mood disorders. Mood disorders involve disturbances in a person's mood that affect their daily life. Major types include depression, persistent feelings of sadness, hopelessness, and lack of interest in activities. Bipolar disorder, characterized by alternating periods of depression and mania, extreme elevated mood. Psychotic disorders. Psychotic disorders involve distorted thinking and awareness. Schizophrenia is the most well-known psychotic disorder, characterized by hallucinations, delusions, and disorganized thinking. Eating disorders. Eating disorders involve preoccupation with food, body weight, and shape. Common types include anorexia nervosa, an intense fear of gaining weight and a distorted body image leading to restricted eating. Bulimia nervosa, episodes of binge eating followed by compensatory behaviors like vomiting or excessive exercise. Binge eating disorder, recurrent episodes of eating large quantities of food, often quickly and to the point of discomfort. Personality disorders. Personality disorders involve enduring patterns of behavior, cognition, and inner experience that deviate markedly from the expectations of the individual's culture. Examples include borderline personality disorder, characterized by instability in moods, behavior, self-image, and functioning. Antisocial personality disorder, a pattern of disregard for, and violation of, the rights of others. Trauma-related disorders. These disorders are triggered by traumatic events. Post-traumatic stress disorder, PTSD, is a primary example, involving symptoms like flashbacks, severe anxiety, and uncontrollable thoughts about the event. Neurodevelopmental disorders. These disorders typically manifest early in development and include attention deficit/hyperactivity disorder, ADHD, characterized by patterns of inattention, hyperactivity, and impulsivity. Autism spectrum disorder, ASD, involves challenges with social skills, repetitive behaviors, and communication. Causes and risk factors. Biological factors. Biological factors include genetic predispositions, neurochemical imbalances, and brain structure abnormalities. Research has shown that genetics can play a significant role in conditions like depression, schizophrenia, and bipolar disorder. Neurotransmitters such as serotonin, dopamine, and norepinephrine also influence mood regulation and are implicated in various mental health disorders. Psychological factors. Psychological factors encompass individual experiences, personality traits, and coping mechanisms. Childhood trauma, chronic stress, and poor coping skills can contribute to the development of mental health issues. Cognitive patterns, such as negative thinking and rumination, are also significant contributors to disorders like depression and anxiety. Environmental factors. Environmental factors include external influences that affect mental health. These can range from socioeconomic status, living conditions, and exposure to violence, to significant life changes such as loss, divorce, or unemployment. Social support systems and community resources play a crucial role in mitigating the impact of these factors. Genetic factors. Genetic predispositions are strongly linked to several mental health disorders. Studies of families, twins, and adoption have provided evidence for the heritability of conditions like schizophrenia, bipolar disorder, and major depressive disorder. Genetic research continues to identify specific genes and their interactions that increase the risk of mental health issues. Interaction of multiple factors. Mental health disorders often arise from a complex interplay of biological, psychological, and environmental factors. For instance, a person may have a genetic predisposition to depression, which is then triggered by stressful life events and exacerbated by maladaptive coping mechanisms. Understanding this multifactorial nature is crucial for effective diagnosis and treatment. Symptoms and diagnosis. Common symptoms of mental health disorders. Mental health disorders manifest through a wide range of symptoms, which can vary significantly in severity and impact daily functioning. Common symptoms include emotional symptoms, persistent sadness, anxiety, mood swings, and irritability. Cognitive symptoms, difficulty concentrating, indecisiveness, memory problems, and irrational thoughts. Behavioral symptoms, withdrawal from social activities, changes in eating or sleeping patterns, substance abuse, and self-harm. Physical symptoms, unexplained aches and pains, fatigue, and changes in weight or appetite. Diagnostic criteria and tools. Diagnosis of mental health disorders typically involves a comprehensive assessment by a mental health professional. This assessment may include clinical interviews, detailed discussions about the individual's symptoms, history, and impact on daily life. Psychological testing, standardized tests and questionnaires to assess specific symptoms and cognitive functioning. Observation, behavioral observations in different settings to understand symptom patterns. Medical evaluation, physical exams and lab tests to rule out underlying medical conditions that could mimic psychiatric symptoms. Role of mental health professionals in diagnosis. Mental health professionals, including psychiatrists, psychologists, and licensed counselors, play a crucial role in diagnosing and treating mental health disorders. They use a combination of clinical expertise, standardized diagnostic tools, and evidence-based practices to formulate accurate diagnoses and develop personalized treatment plans. Treatment and management. Psychotherapy. Psychotherapy, or talk therapy, is a primary treatment approach for many mental health disorders. Different forms of psychotherapy include cognitive behavioral therapy. CBT focuses on identifying and changing negative thought patterns and behaviors. Psychodynamic therapy explores unconscious processes and past experiences that influence current behavior. Dialectical behavior therapy, DBT, combines CBT with mindfulness techniques to address emotional regulation and interpersonal effectiveness. Interpersonal therapy, IPT, targets interpersonal issues and their impact on mood and behavior. Pharmacotherapy. Medications are often used in conjunction with psychotherapy to manage mental health disorders. Common classes of medications include antidepressants, used to treat depression, anxiety, and other mood disorders. Antipsychotics, prescribed for psychotic disorders like schizophrenia. Mood stabilizers, used for conditions like bipolar disorder. Anxiolytics, medications that reduce anxiety symptoms. Alternative treatments. Alternative treatments, while not replacements for conventional therapies, can complement traditional approaches. These include meditation and mindfulness, techniques that promote relaxation and stress reduction. Yoga and exercise, physical activities that improve mood and overall well-being. Nutritional supplements, certain vitamins and minerals may support mental health, though more research is needed. Lifestyle changes and self-care. Adopting a healthy lifestyle can significantly impact mental health. Key aspects include balanced diet, nutrient-rich foods that support brain function. Regular exercise, physical activity that releases endorphins and reduces stress. Adequate sleep, ensuring sufficient rest to maintain cognitive and emotional health. Stress management, techniques like time management, relaxation exercises, and hobbies. Integrated treatment approaches. Integrated treatment approaches combine multiple therapies and support systems to address the diverse needs of individuals with mental health disorders. These may include coordinated care from healthcare providers, social workers, and community resources to provide comprehensive support. Impact on different populations. Mental health in children and adolescents. Mental health issues in children and adolescents can have profound effects on development, education, and social relationships. Early intervention is crucial for behavioral disorders, ADHD, conduct disorder, and oppositional defiant disorder. Mood disorders, depression and anxiety in young people. Developmental disorders, autism spectrum disorder, and learning disabilities. Mental health in adults. Adult mental health encompasses a wide range of issues, including workplace stress, the impact of job-related stress on mental health. Relationship issues, the role of personal relationships in mental well-being. Chronic illness, managing mental health in conjunction with chronic physical conditions. Mental health in the elderly. Mental health in the elderly often involves challenges related to aging, such as dementia, cognitive decline and its impact on mental health. Depression, common in older adults, often related to loss, isolation, and health issues. Anxiety can increase with age due to health concerns and life changes. Gender differences in mental health. Gender can influence the prevalence and expression of mental health disorders. Women, more likely to experience depression and anxiety, influenced by hormonal, social, and cultural factors. Men, higher rates of substance abuse and antisocial behaviors, often linked to social expectations and stigma around expressing emotions. Cultural and socioeconomic influences on mental health. cultural and socio-economic factors play a significant role in mental health. Cultural beliefs influence how mental health is perceived and treated within different communities. Socioeconomic status, poverty, lack of access to healthcare, and social instability can exacerbate mental health issues. Discrimination and marginalization. Experiences of discrimination can lead to increased stress and mental health challenges. Stigma and mental health. The nature of mental health stigma. Stigma involves negative attitudes and beliefs about mental health disorders, leading to discrimination and marginalization of those affected. It manifests in public stigma, societal attitudes that devalue individuals with mental health issues. Self-stigma, internalized negative beliefs that affect self-esteem and recovery. Effects of stigma on individuals and society. Stigma can have profound effects on individuals and society. Barriers to treatment. Fear of judgment can prevent people from seeking help. Social isolation. Stigmatized individuals may withdraw from social interactions. Reduced opportunities. Stigma can limit access to education, employment, and housing. Mental health outcomes. Stigma exacerbates symptoms and hinders recovery. Strategies to combat stigma. Efforts to reduce stigma include education and awareness, public campaigns to increase understanding and acceptance of mental health issues. Advocacy, efforts by individuals and organizations to promote mental health rights and policies. Support networks, creating inclusive communities that offer support and acceptance. Mental health and society. Economic impact of mental health disorders. Mental health disorders have significant economic implications. Healthcare costs, increased demand for mental health services and treatments. Lost productivity, absenteeism and reduced work performance due to mental health issues. Disability benefits, financial support for individuals unable to work due to mental health conditions. Mental health in the workplace. Promoting mental health in the workplace is crucial for employee well-being and productivity. Workplace programs, initiatives that support mental health, such as employee assistance programs and stress management workshops. Work-life balance, policies that promote flexibility and prevent burnout. Creating a supportive environment, encouraging open discussions about mental health and providing resources. Mental health in schools. Schools play a vital role in supporting the mental health of students. Counseling services, access to school counselors and psychologists. Mental health education, integrating mental health topics into the curriculum. Early intervention, identifying and addressing mental health issues early. Role of media and technology in mental health. Media and technology have a complex relationship with mental health. Positive influences, online support groups, mental health apps, and educational content. Negative influences, cyberbullying, social media pressures, and misinformation. Balancing use, encouraging healthy use of technology and media. Global perspectives on mental health. Mental health in different cultures. Cultural perspectives on mental health vary widely. Traditional beliefs, different cultures have unique beliefs about the causes and treatment of mental health issues. Access to care, availability of mental health services varies globally, influenced by cultural, economic, and political factors. Integration of traditional and modern approaches, combining traditional healing practices with modern mental health care. Global mental health initiatives and organizations. International efforts to address mental health include World Health Organization, WHO global initiatives to improve mental health awareness, treatment, and policy. Global mental health movement, advocacy for mental health as a human right and a global priority. Non-governmental organizations, NGOs providing mental health services and support in underserved regions. Challenges and opportunities in global mental health. Global mental health faces various challenges and opportunities. Resource limitations, limited funding and infrastructure in many regions. Stigma and cultural barriers, overcoming stigma and cultural resistance to mental health care. Innovation and collaboration, leveraging technology, research, and international partnerships to improve global mental health outcomes. Personal stories and case studies. Real-life stories of mental health challenges. Personal stories provide powerful insights into the experiences of those with mental health disorders. Individual narratives, accounts of struggles, treatments, and recovery journeys. Impact on families, how mental health issues affect loved ones and support systems. Lessons learned, insights and advice from those who have navigated mental health challenges. Case studies of treatment and recovery. Case studies highlight effective treatment approaches and recovery outcomes. Successful interventions, examples of therapies and strategies that have led to positive outcomes. Challenges and setbacks, understanding the complexities and obstacles in mental health treatment. Holistic approaches, case studies emphasizing the importance of integrated and comprehensive care. Future directions in mental health. Advances in research and treatment. Ongoing research continues to advance the understanding and treatment of mental health disorders. Genetic and neuroscientific research, uncovering the biological underpinnings of mental health conditions. New therapeutic approaches, developing innovative treatments, such as neuromodulation and digital therapeutics. Personalized medicine, tailoring treatments to individual genetic and clinical profiles. The role of technology and innovation. Technology is transforming mental health care. Telehealth, expanding access to mental health services through remote consultations. Mental health apps, tools for monitoring symptoms, providing therapy, and promoting self-care. Virtual reality, VR, using VR for exposure therapy and other therapeutic interventions. Policy changes and advocacy for mental health. Advocacy and policy efforts are crucial for improving mental health care. Mental health legislation, enacting laws to protect and support individuals with mental health disorders. Funding and resources, increasing investment in mental health services and research. Public awareness campaigns, promoting mental health education and reducing stigma. Conclusion. Recap of key points. In this comprehensive exploration of mental health, we have covered the historical evolution of mental health understanding, the various types of mental health disorders, their causes and symptoms, and the treatments available. We have also examined the impact of mental health on different populations, the pervasive issue of stigma, and the intersection of mental health with societal issues. Importance of continued awareness and advocacy. Mental health is a critical aspect of overall well-being, yet it often remains misunderstood and stigmatized. Continued efforts to raise awareness, promote understanding, and advocate for better mental health care are essential for improving the lives of individuals affected by mental health disorders. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.